Question 1. A patient is seen in the office for a follow-up visit after a hip replacement performed 2 months ago. The physician checks the surgical incision and assesses the patient's progress with physical therapy. How should this visit be coded from a CPT perspective? A. Code a subsequent established patient E/M visit with modifier -24. B. Code a subsequent established patient E/M visit. C. Code a postoperative visit, no separate E/M code. D. Code a subsequent established patient E/M visit with modifier -79. Answer: C. Code a postoperative visit, no separate E/M code. This question tests your understanding of CPT global surgery periods. A hip replacement has a typical global period of 90 days, meaning most follow-up care related to the surgery is included in the original surgical code and cannot be billed separately. Checking the incision and assessing therapy progress are considered routine postoperative care within this period. Therefore, no separate E/M code is reported unless the visit addresses an unrelated problem or a complication requiring significant additional work beyond normal post-op care, neither of which is indicated here. Remember that follow-up care within the global period is usually bundled into the surgery code fee. Question 2. A 55-year-old male is diagnosed with type 2 diabetes mellitus with diabetic neuropathy of the lower limbs. What is the correct ICD-10-CM code assignment for this diagnosis? A. E11.40. B. E11.42. C. G63.5. D. E11.42, G63.5. Answer: B. E11.42. This question requires applying ICD-10-CM coding guidelines for combination codes. ICD-10-CM has combination codes that include both the underlying condition, type 2 diabetes, and a related complication, neuropathy. The code E11.42 specifically captures type 2 diabetes mellitus with diabetic polyneuropathy. When a combination code exists that fully describes the conditions, only the combination code is reported. There is no need to code the neuropathy separately as G63.5 because it is included in the combination code. Always look for a single code that represents both the cause and the manifestation. Question 3. A physician provides critical care services to a 45-year-old patient who is in respiratory failure in the intensive care unit. The physician spends 75 minutes providing these services, which included managing the patient's ventilator settings, reviewing lab results, and discussing the patient's status with the family. What is the appropriate CPT codes? A. 99291 only. B. 99291, 99292. C. 99205. D. 99233. Answer: B. 99291, 99292. This question tests your knowledge of CPT critical care coding. Critical care codes, 99291 to 99292, are time-based codes used for the care of critically ill or injured patients. The first hour is reported with code 99291, and each additional 30 minutes is reported with code 99292. For 75 minutes of critical care, you would code the first 30 to 74 minutes with 99291, and the remaining 15 minutes, which falls within the 30-minute increment for 99292, with 99292. Critical care time is reported in full 30-minute increments after the initial hour, and any time less than 30 minutes but exceeding the initial hour threshold counts towards a 99292. Question 4. Which of the following is a key component in selecting an E/M service code based on the traditional 3 key components: history, examination, medical decision-making? A. Counseling. B. Coordination of care. C. Nature of presenting problem. D. Medical decision-making. Answer: D. Medical decision-making. This question focuses on the traditional key components used for selecting many E/M service codes. While counseling, coordination of care, and the nature of the presenting problem are elements of an E/M service, only history, examination, and medical decision-making, MDM, are considered the key components used to determine the level of service for codes requiring their documentation, like office visits for established patients using the 1995/1997 guidelines or the older version of new patient visits. MDM is often considered the most important factor as it reflects the complexity of the physician's thought process in managing the patient's condition. Remember the three key components: history, exam, and MDM. Question 5. A patient presents with coughing and fever. The physician diagnoses acute bronchitis. In ICD-10-CM, how is acute bronchitis classified? A. J20.9. B. J40. C. J41.0. D. J18.0. Answer: A. J20.9. This question requires locating the correct ICD-10-CM code for acute bronchitis. Acute bronchitis is an acute inflammation of the bronchi. Looking up bronchitis, acute in the ICD-10-CM index directs you to code J20-. The .9 subcategory is for unspecified acute bronchitis, which is appropriate when the specific type of bronchitis, e.g., due to mycoplasma or streptococcus, is not documented. Code J40 is for bronchitis, not specified as acute or chronic, which is less specific. J41.0 is simple chronic bronchitis, and J18.0 is bronchopneumonia. Code J20.9 correctly identifies the documented condition. Question 6. A pathologist examines a biopsy of a skin lesion. The report describes the gross and microscopic findings. Which CPT section would you look in to find the appropriate code for the pathologist service? A. Surgery. B. Medicine. C. Radiology. D. Pathology and laboratory. Answer: D. Pathology and laboratory. This question asks about the location of pathology services within the CPT manual. Services performed by a pathologist, such as examining tissue biopsies, gross and microscopic examination, are found in the pathology and laboratory section of the CPT codebook. The surgery section is for surgical procedures. Medicine covers various non-surgical procedures like immunizations or infusions, and radiology is for imaging services. Pathologists' work falls specifically under the pathology and laboratory services. Question 7. Which of the following is a correct definition of the medical term arthralgia? A. Joint inflammation. B. Muscle pain. C. Nerve pain. D. Joint pain. Answer: D. Joint pain. This question tests basic medical terminology, specifically related to musculoskeletal symptoms. The term arthralgia is composed of two parts: arthro- meaning joint, and algia meaning pain. Therefore, arthralgia means joint pain. Arthritis means joint inflammation, myalgia is muscle pain, and neuralgia is nerve pain. Breaking down medical terms into their root words, prefixes, and suffixes is a key skill in medical coding. Question 8. A patient is admitted to the hospital with severe pneumonia. The physician documents pneumonia due to Streptococcus pneumoniae. What is the correct ICD-10-CM code? A. J18.9. B. J13. C. J15.4. D. J18.0. Answer: C. J15.4. This question requires selecting the correct ICD-10-CM code for pneumonia when the causative organism is specified. The documentation clearly states the pneumonia is due to Streptococcus pneumoniae. In the ICD-10-CM index, looking up pneumonia, streptococcal or pneumonia, due to Streptococcus pneumoniae leads to code J15.4. Code J18.9 is for pneumonia, unspecified organism, which would be incorrect because the organism is known. J13 is for pneumonia due to Streptococcus group A, which is different. J18.0 is bronchopneumonia, unspecified. Always code to the highest level of specificity provided in the documentation, including the identified infectious agent. Question 9. Which CPT modifier indicates that a service was mandated by a third-party payer or governmental regulatory agency? A. -22. B. -32. C. -50. D. -79. Answer: B. -32. This question asks about a specific CPT modifier's function. Modifier -32, mandated services, is appended to a CPT code when the service, e.g., a consultation or second opinion, is required by a third-party payer, governmental regulatory agency, or quality improvement organization, QIO. Modifier -22 is for increased procedural services, -50 is for bilateral procedures, and -79 is for an unrelated procedure by the same physician during the postoperative period. Understanding modifier definitions is crucial for accurate billing. Question 10. A physician performs a unilateral screening mammogram. What HCPCS Level II code is typically used for this service? A. 77067. B. G0202. C. 77063. D. G0204. Answer: D. G0204. This question requires knowing the correct HCPCS Level II code for a specific service often billed to Medicare or other payers who prefer G codes for screening services. HCPCS code G0204 is specifically for a unilateral screening mammogram. While CPT has codes for mammography, like 77067 for screening bilateral, payers like Medicare often require the use of G codes for certain screening services to track them separately. G0202 is for bilateral screening mammograms, and CPT codes 77067 and 77063 are CPT codes for screening and diagnostic mammograms, respectively, which may not be the preferred code by all payers for screening. Always check payer-specific guidelines, but G codes are common for Medicare screening services. Question 11. A patient is diagnosed with essential hypertension and benign prostatic hyperplasia, BPH. How should these diagnoses be sequenced in ICD-10-CM? A. N40.1, I10. B. I10, N40.1. C. I10, N40.0. D. N40.0, I10. Answer: B. I10, N40.1. This question tests basic ICD-10-CM sequencing rules. When a patient has multiple unrelated conditions treated during the same encounter, the sequencing is typically based on the reason for the encounter or the severity of the conditions. In the absence of specific guidance linking these two conditions, which is not the case here, they are unrelated. The primary reason for the visit or the condition treated/managed should be listed first. Assuming the visit is for management of both conditions without one being clearly primary over the other, standard practice often lists the more significant or complex condition first, but importantly, there is no mandated sequencing rule for unrelated conditions unless one affects the treatment of the other. However, I10, essential hypertension, and N40.1, benign prostatic hyperplasia with lower urinary tract symptoms, are coded separately and sequenced according to the reason for the encounter. The options require a sequencing choice. Since neither is specified as primary, the order in option B is a valid sequencing assuming both were managed. Option A sequences BPH first, which is less common unless BPH was the primary focus. Option C and D use N40.0, which is BPH without lower urinary tract symptoms, and the scenario-specified BPH. Therefore, I-10 followed by N40.1 correctly codes both conditions. Question 12. A physician performs an excision of a malignant melanoma from the patient's back. The excision required intermediate repair. In addition to the excision code, what other service may be reportable? A. Simple repair. B. Intermediate repair. C. Complex repair. D. No separate repair code is reported. Answer: B. Intermediate repair. This question involves coding excision of a lesion and subsequent repair. CPT guidelines state that simple repairs are considered bundled into excision codes and are not reported separately. However, intermediate and complex repairs are typically reported separately in addition to the excision code. Since the documentation specifies intermediate repair, this service can be coded separately. Always remember that the complexity of the repair determines if it's separately billable after an excision. Question 13. Which anatomical term means situated toward the head? A. Caudal. B. Distal. C. Cranial. D. Ventral. Answer: C. Cranial. This question asks about a fundamental anatomical directional term. Cranial means relating to the skull or head, or directed toward the head. Caudal means toward the tail or inferior part of the body. Distal means situated farthest from the point of origin or attachment. Ventral means relating to the front or belly side of the body. Knowing directional terms like cranial, caudal, distal, and ventral is essential for understanding operative reports and other medical documentation. Question 14. A patient receives an injection of a drug in the office. In addition to the administration code, how is the drug itself typically reported? A. Using a CPT code. B. Using an ICD-10-CM code. C. Using a HCPCS Level II J code or C code. D. It is included in the administration code. Answer: C. Using a HCPCS Level II J code or C code. This question addresses how injectable drugs administered in an outpatient setting are reported. While CPT codes are used for the administration of the injection, the drug product itself is typically reported using a specific HCPCS Level II code, often a J code, for drugs administered other than by oral method, or sometimes a C code, for pass-through drugs, often used in hospital outpatient settings. ICD-10-CM codes are for diagnoses. The drug is not included in the administration code, it is a separate supply that is billed. Question 15. According to CPT guidelines, what is the purpose of a modifier? A. To change the definition of a CPT code. B. To provide additional information about a service or procedure. C. To indicate a diagnosis. D. To determine the primary reason for the encounter. Answer: B. To provide additional information about a service or procedure. This question asks about the fundamental purpose of CPT modifiers. Modifiers are two-digit codes appended to a CPT code to indicate that a service or procedure has been altered by specific circumstances, but its basic definition has not changed. They provide additional information necessary for proper payment, such as indicating that only a portion of a service was performed, a service was bilateral, or multiple procedures were performed during the same session. Modifiers do not change the code's definition, indicate a diagnosis, or determine the primary reason for the visit. Question 16. A patient is diagnosed with unstable angina. In ICD-10-CM, how is this condition classified? A. I-20.0. B. I-20.8. C. I-24.0. D. I-25.110. Answer: C. I-24.0. This question tests your ability to code specific types of angina pectoris in ICD-10-CM. Unstable angina is a form of acute coronary syndrome and is classified separately from other types of angina. Looking up angina, unstable, in the ICD-10-CM index directs you to code I-24.0. Code I-20.0 is for unstable angina with atherosclerosis, which is more specific. I-20.8 is other forms of angina, and I-25.110 is for atherosclerotic heart disease of native coronary artery with unstable angina pectoris, another more specific code. Without documentation of atherosclerosis, I-24.0 is the correct code for simply unstable angina. Always code based on the provider's documentation and select the code that best matches the documented condition. Question 17. When coding for a surgical procedure in CPT, the global period refers to A. The time it takes to perform the surgery. B. The time before, during, and after a surgery during which related services are included in the surgical package. C. The time a patient spends in the hospital after surgery. D. The time allowed for the patient to recover completely. Answer: B. The time before, during, and after a surgery during which related services are included in the surgical package. This question defines the CPT global surgery period. The global period is a defined timeframe surrounding a surgical procedure during which all routine preoperative, intraoperative, and postoperative care related to the surgery is included in the single fee for the surgery code. The length of the global period varies by procedure, e.g., 0, 10, or 90 days. Services performed within the global period that are unrelated to the surgery or are for complications requiring significant additional work may be billed separately with appropriate modifiers. Understanding the global period is essential to avoid incorrect billing. Question 18. A physician dictates that the patient has bilateral carpal tunnel syndrome. In ICD-10-CM, how is this coded? A. G56.00. B. G56.01. C. G56.02. D. G56.03. Answer: D. G56.03. This question tests coding laterality in ICD-10-CM. Carpal tunnel syndrome affects a specific location and can occur on the left, right, or both sides. ICD-10-CM provides specific codes for laterality when available. Code G56.03 is for bilateral carpal tunnel syndrome, G56.01 is for the right wrist, and G56.02 is for the left wrist. G56.00 is for unspecified carpal tunnel syndrome, which should not be used when laterality is documented. Always code to the highest level of specificity, including laterality if provided. Question 19. Which type of code describes medical services and procedures performed by physicians and other healthcare professionals? A. ICD-10-CM. B. HCPCS Level II. C. CPT. D. DRG. Answer: C. CPT. This question asks you to identify the coding system used for reporting medical services and procedures. CPT, current procedural terminology, codes are used to describe tests, surgeries, evaluations, and other procedures performed by physicians and other healthcare providers. ICD-10-CM codes are used for diagnoses. HCPCS Level II codes are primarily used for products, supplies, and services not covered by CPT codes, such as ambulance services or durable medical equipment. DRG, Diagnosis-Related Group, is a classification system used for hospital inpatient stays, not individual services. CPT is the standard for reporting procedures. Question 20. A patient is seen for a follow-up visit for chronic obstructive pulmonary disease, COPD, and is also evaluated for a new onset migraine headache. How should the diagnoses be sequenced for the E/M service? A. G43.909, J44.9. B. J44.9, G43.909. C. J44.9 only. D. G43.909 only. Answer: B. J44.9, G43.909. This question involves sequencing diagnoses for an outpatient visit where multiple conditions are addressed. The sequencing of diagnoses in ICD-10-CM should reflect the reason for the encounter and the conditions treated or managed. Typically, the diagnosis chiefly responsible for the outpatient service is listed first, followed by other diagnoses that were treated or affected care. While both conditions were managed, the encounter was for follow-up of COPD and evaluation of a new migraine. There isn't a clear primary reason given, but listing both is crucial as both were addressed. Without further context on which was the primary focus, listing the chronic condition, COPD, or the acute new problem, migraine, first is acceptable as long as both are listed and accurately reflect the services provided. However, option B sequences COPD followed by migraine, which is a common approach when managing both chronic and acute issues. Listing only one diagnosis, C or D, would be incorrect as both were evaluated. Option A reverses the order of B. Sequencing often depends on the provider's documentation of the focus of the visit, but showing both diagnoses managed is key. Question 21. Which part of the CPT manual would you find codes for laboratory tests? A. Surgery. B. Radiology. C. Pathology and laboratory. D. Medicine. Answer: C. Pathology and laboratory. This question asks about the structure of the CPT manual. Codes for laboratory tests, including blood work, urinalysis, and other specimen analysis, are located in the pathology and laboratory section of the CPT codebook. This section covers various tests performed on specimens to diagnose or monitor conditions. Surgery, radiology, and medicine sections cover different types of services. Question 22. A child falls and sustains a laceration to the forehead that requires sutures. The physician performs a simple repair. What is the correct approach to coding the repair? A. Select a CPT code for simple repair of the forehead. B. Select a CPT code for complex repair of the forehead. C. Select an ICD-10-CM code for the laceration. D. The repair is included in the E/M visit and not coded separately. Answer: A. Select a CPT code for simple repair of the forehead. This question focuses on coding wound repairs in CPT. When a laceration requires sutures, a repair code from the CPT surgery section, integumentary system, is typically reported in addition to the E/M visit code. The type of repair, simple, intermediate, or complex, and the location and length of the wound determine the specific CPT code. A simple repair is coded separately from the E/M unless it's a very minor, incidental repair. Complex repair would only be coded if the repair met the criteria for complexity. An ICD-10-CM code is for the diagnosis, laceration, not the procedure. Simple repairs requiring sutures are reportable procedures. Question 23. A patient is admitted to the hospital with chest pain. The physician suspects an acute myocardial infarction, MI. Diagnostic tests confirm an acute ST elevation myocardial infarction, STEMI, of the anterior wall. What is the correct ICD-10-CM code? A. I21.01. B. I21.9. C. I25.10. D. R07.9. Answer: A. I21.01. This question requires coding a specific type of acute myocardial infarction. ICD-10-CM codes for acute MIs are very specific regarding the type, STEMI or NSTEMI, and location. I-21.01 is the specific code for ST elevation, STEMI, myocardial infarction of the anterior wall. I-21.9 is for unspecified acute MI, which is less specific and incorrect when the type and location are known. I-25.10 is for atherosclerotic heart disease, which is a related but different diagnosis. R07.9 is for chest pain, unspecified, which is a symptom, not the confirmed diagnosis of MI. Always code the confirmed diagnosis to the highest specificity. Question 24. When coding for an E/M service based on time, what must the medical record documentation include? A. The total time spent by the physician face-to-face with the patient. B. A statement that more than 50% of the encounter was spent on counseling or coordination of care. C. The medical necessity for basing the code on time. D. All of the above. Answer: D. All of the above. This question addresses the documentation requirements for billing E/M services based on time, when time is the primary determinant. According to CPT guidelines, when using time to select the E/M level, for codes where time is a factor, the documentation must reflect the total time spent, state that more than 50% of that time was dedicated to counseling or coordination of care. For codes where this rule applies, like office visits using the older guidelines, and demonstrate the medical necessity for providing those services. While recent E/M changes allow some codes to be selected based on total time spent on the date of service, the principles of documenting time, activity, and medical necessity remain crucial. Thorough time documentation is key when using it for code selection. Question 25. A patient receives a kidney transplant due to end-stage renal disease, ESRD. What is the correct ICD-10-CM code for the transplanted kidney? A. Z94.0. B. N18.6. C. T86.10. D. Z99.2. Answer: A. Z94.0. This question asks for the ICD-10-CM code indicating the presence of a transplanted organ. ICD-10-CM has specific codes in the Z chapter, factors influencing health status and contact with health services, to indicate the presence of transplanted organs. Z94.0 is the correct code for a kidney transplant status. N18.6 is for end-stage renal disease, which is the reason for the transplant, not the transplant itself. T86.10 would be used for complications of a kidney transplant, and Z99.2 is for dependence on renal dialysis. Always code the presence of the transplanted organ using the appropriate Z code.